Now to medicine on the cutting edge, new technology that could save your life if you feel those chest pains signaling heart trouble. It's a tiny high-resolution camera that is actually inserted into the beating heart for a much clearer picture than ever before. Dr. Richard Besser has more on this brand new technology approved just 3 weeks ago by the FDA.
This is the tiny device opening a promising new window into the heart, which could help treat patients with heart disease. People like 60-year-old Mac Bailey, who had a heart attack earlier this month.
I had tightness in the chest. 2 minutes after that, I broke out in sweat.
He was rushed to Cleveland's University hospitals, where doctors placed a stent after unblocking one of his arteries. Like doctors across the U.S., they chose where and how to place it, relying on an intravascular ultrasound, a shadowy image that looks like this.
I walk into hearts of people without much visualization.
But now this new device offers an alternate and remarkable view. It's called optical coherence tomography, or OCT. And we were there when Dr. Marco Costa used it to place 2 more stents in Mac's arteries, one of the first times OCT has been used since its FDA approval. It forms images by reflecting light inside blood vessels, allowing doctors to see 10 times more detail.
When I first saw this, I was like, oh my God, this is unbelievable. So it's like walking to a totally different world.
Compare the intravascular ultrasound with the OCT. And in the case of Mac Bailey, OCT helped Dr. Costa make an important discovery.
And then you see it's like a volcano just trying to explode.
Able to see plaque here more clearly, he determined it was another artery that caused the heart attack and needed a stent.
Right there. And if he had gone home over the weekend and not having had this procedure today, this patient would have gone home with a very nice, well-placed stent in a vessel that did not cause his heart attack.
Now, while the pictures are impressive, OCTs have not been shown to give better results than intravascular ultrasound. But for patients like Mac, this cutting-edge technology could improve the treatment he receives in the future.
I feel good. I'm blessed.
And Rich Besser is here now with the tiniest camera I've ever seen.
This is it. Have a look here. If you look closely, you'll see a little red light. That little red light is the lens of the camera. You can fit 25 of these catheters in an inch. I mean, it's that small. As I put my finger on here and you look at the screen, you'll see a magnification of my skin cells, the pores, the sweat glands. And so when you put that in an artery, it may be able to see a plaque that's getting ready to break off. It's incredible.
It could, but we haven't actually had this all tested yet.
Right. You know, whenever we present new technology, you have to put it in that context. This has been approved. Now it needs to be studied to see, are the outcomes better than with the old technology? If they're not, you wouldn't expect insurance to pay for it or Medicare to pay for it. It's very important that you see the new technology, but you wait to see, is it better?
Okay, so we'll be testing that in the coming weeks and months. Rich Besser, thanks very much. There's a lot more info on how to care for your heart on our website at abcnews.com.